I'd like to welcome you to the last section. Hopefully your breakout sessions that you attended were great. You got a chance to visit with all of our exhibitors, and you're ready to kick off the rest of the day here. I'm excited now to introduce the final session of the day, Cancer Control in Action in Wisconsin. Please welcome our moderator for this session, Gail Johnson. Many of you know, Gail. Gail has been the director of the Wisconsin Wellness Program in the Department of Health Services for more than 20 years. This statewide program is Wisconsin's component of the National Breast and Cervical Cancer Early Detection Program administered by the Centers for Disease Control and Prevention. Please join me in welcoming Gail Johnson.
Thank you, Paula. And this is the last session for our summit. And I know I've been saying afternoon and morning and evening at the wrong time, but really this time, good afternoon. Okay, all right. We are going to be looking at cancer control in action in Wisconsin. And in terms of our session, the 2020 through the 2030 Wisconsin Cancer Plan lays out a blueprint for action with a singular vision. And that vision is creating a healthier Wisconsin by reducing the burden of cancer for everyone. The success of the Wisconsin Cancer Plan depends on people and organizations from multiple sectors coming together to take action. The plan relies on countless dedicated people in communities working together to reduce the burden of cancer. We are honored and privileged to have 4 members of our cancer control community here this afternoon to talk about the work that they do and the contributions of their organization regarding cancer control in action. So our first presenter is none other than, and you saw her earlier this afternoon because she accepted a much-deserved award. Judy Heubel is the Community Health Outreach Director for the Stockbridge-Munsee Health and Wellness Center. Judy, I'm going to turn it over to you.
Pomosi, Yusenji, Hito Nakwe, Nino Gio, Mohikman. So I was just explaining that my English name is Heubel, and I go by Judy. I do work for the Stockbridge-Munsee tribe in central Wisconsin. So the award I got earlier, which I'm very grateful for, thank you very much, was for the program we initiated for radon testing in our community. And we had a lot of help from a lot of different folks in pulling that together. Stockbridge-Munsee are one of the 11 federally recognized tribes in Wisconsin. And we're sort of a couple hours just north of here, about 2.5 hours north. And our reservation is adjacent to the Menominee Reservation, if anybody's wondering where that is. We're one of the smaller tribes in Wisconsin. We have about 1,800 enrolled members right now. Many of them live on the reservation, about a little over 30% right now. We are, our casino is the North Star Casino, and we are one of the largest employers in Shawano County. And our tribe has 2 official languages, Mohican and Munsee. And that little brown area over there, I don't know if we have a pointer, over here is where our reservation is located in Shawano County. And you can see that Menominee County is right here next to us. And not too far from Shawano, but we are a pretty rural area. Shawano is the city that's closest to us, and it's a pretty small town, actually. And that's about 30 minutes away. And then for other healthcare services, we travel to either Green Bay Wausau or Appleton, which are all about an hour away from my reservation. And this is what a reservation actually looks like. The white part it's kind of a patchwork. But this is all within the original boundaries that were established for our tribe. When we moved to that area, our tribe is actually originated in the East Coast and was now known as New York along the Hudson River Valley. And our tribal name is traditionally known as Mohikanu, which is the people of the water that's never still. And this just shows one of the rivers that run through our community. Here it is. And this is a map of Wisconsin from the Wisconsin Department of Health Services, which shows radon areas in Wisconsin. And our tribe is right up here in Shawano County. And you can see that's one of the darker areas up there. So our ask was that we be able to do some testing to check on radon mitigation levels. And as you're probably aware, Native Americans have a pretty high cancer rate. And, you know, often due to the remoteness of our reservations, and getting people in for treatment, we could have a pretty high mortality rate from cancer too. So as part of the Cancer Control Collaborative, we started working on some of the initiatives in here. And under number 6, risk reduction, priority number 6, we're working on the decreasing the exposure to radon. And so the plan to do that was to build awareness in the community, eventually get all the homes on the reservation tested and install the mitigation systems where they're needed. So we have approximately 30 private homes on the reservation. That doesn't include the tribal housing, apartments or buildings, tribal buildings. It's just 30 private homes. So that was our target. So far we've just distributed 115 of the test kits and had 84% of them returned. And of course it changes as we get them back, but our rates of radon above the recommended amount of 4 pickle, I forget how they measure it, but it's above 4. It ranges 65 to 68% in that range. So we were able to get some help from Dr. LaConte, helped us get some funding through the Carbon Cancer Center and UW to complete 25 mitigations for people who had the higher rates. And since then, it's really spawned an awareness, which was something we were hoping to do. And our tribe has taken on the task of helping others get their homes tested and mitigated. So we're really happy about that. We have a lot of help. I want to say Nishik Nawi to Jess Maloney from the Department of Health Services. She helped us get some test kits and get that testing started. Now she's working in another capacity, but we're very happy to have her. Dr. LaConte and Jess both came up, did public awareness in the community, giving community talks. I also want to help say thank you to Beth and Mary for their help with the permanent collaborative with getting the financing all straightened, because that was kind of a pain, but so that's kind of where we are now, and we're hoping to continue that as we work towards other risk reduction methods.
Thank you, Judy, and we will take questions at the end for our presenters. So our next presenter, and I just met her today, and I say that because people always accuse me that you know everybody. I just met her today, but we are going to be friends. Okay, so Ilka Hoffins is Program Director for Team Phoenix, which is part of Aurora Health Care's Cancer Survivorship Program. So Ilka, I'm gonna turn it over to you.
First of all, thanks for having me. I feel really honored to be a part of this all the different speakers we've had over the whole conference. It's every year, I think I learn so much being a part of this cancer collaborative, coming to these events, networking, and from everyone's presentation. So I'm honored to be a part of it this year. So I'm with Team Phoenix, and our goal, like a lot of different presentations we've listened to, is to empower cancer survivors. And for today, I'd like to tell you about Team Phoenix if you're not familiar with it, tell a little bit about how it's changing lives of female cancer survivors long term, and then also just give some ideas, because oftentimes people say, how can I start a Team Phoenix? And whether you can start one or not, you definitely can take a lot of these ideas to your own community and build resources that will change lives forever. So I'm fortunate to be a part of a strong leadership team. Having leadership that backs you up is going to be the #1 thing I will tell you need to start a program that's as comprehensive as this. So that's the very first thing I'm fortunate for. We know from surveys, we started in 2011, it was just a little grassroots effort between a breast cancer surgeon, Dr. Judy, and a rehabilitation specialist, oncology focused physical therapist, Dr. Leslie Walke. They had an idea to try to help people get their mojo back, and started this training for a triathlon with deconditioned survivors. And since 2011, we started with like 10 women. We've expanded to female, all cancers, and we've already had 375 people who have gone through our program and crossed the finish line of the sprint distance triathlon. And something we've learned by asking these women is, what do you feel like you had a good transition from treatment to survivorship? And over 70% have said they would have liked more support, that they had excellent treatment wherever they were, but that transition is scary, and the fear of reoccurrence and everything. And so they feel that having more survivorship programs out there is helpful. So our mission is to help cancer survivors improve their quality of life and longevity by establishing lifelong habits of exercise, healthy eating, and the camaraderie piece is huge for us. So these are going to be, the pictures you see are people that have been through our program, and I'll just make a note, I'll mention it later, but when you see the people in purple, those are cancer survivors who are doing our program. We have like uniforms. And then if you see other colors, orange, everybody you see in orange is going to be a volunteer. In red are medical volunteers, and in blue are our coaches. So Team Phoenix triathlon training, we know surgery, chemo, radiation, that was not by choice. You don't have to have had all 3 of those treatments, but you have to have gone through a cancer treatment process. And now people are coming to us choosing to swim, bike, and run. And that is just empowering to people. And we know it's part of our program is having this common and challenging goal. We know most people have not done a triathlon, less than 2% of the whole population has done a triathlon. So people are coming and they're really putting their safety and their success in our hands. And we promise them that they will have a 14-week if they follow our prescribed plan. And it's every year it's a new group of people from mid-April to the end of July. And there's a little pre-season learn to swim, because I would say about 25% of our women are not, either they're fearful of the water or they're not swimmers. So we have to teach them to swim. We also have education, nutrition, mindfulness, yoga, a variety of healthy lifestyle education. And then when they cross the finish line, they become triathletes and also become an alumni, which is a huge status symbol for the people in our area. And these are some of our women that are actually wearing some of our other jackets and things that they enjoy. So really important to removing the common barriers of exercise for us at a no judgment zone. Over 50% of our athletes have never been at all a part of any exercise program, organizational program, or an athlete. And you know, that was a big mind shift for me, because I grew up just in every little neighborhood or school activity and sports and things. And so we really have to be conscious of the fact that nobody wants to be judged. They want to be reassured that they are going to be successful and that they're going to be accepted. So any type of cancer, any type of fitness level, any age, you can have completed your treatment a long time ago, or you can have just completed it as long as you can meet the basic requirements. And we accept people from any, like you could have had your treatment done in Ohio 10 years ago. You can still join Team Phoenix. So we ask that they have a can-do attitude. You have to choose to join the program and that you're available for the 14 weeks, twice a week group training, a commitment to following our training plan. You have to have a medical clearance from any doctor. It doesn't have to be an oncologist, but somebody has to say you're physically fit, not fit, but like physically capable. And then swim any stroke for the length of the pool or take our learn to swim, walk 100 yards unassisted, bike 100 yards unassisted. And we have individualized training. So it's a lot like Dr. Matt Wiggins was saying, it's individualized in that we have beginning, intermediate, advanced swim, bike, run, and strength. We try within that to be as individualized as we can, but because we have about 50 new people every year, it's not like every single person is getting their own plan, but we're individualizing it as best we can. We're helping, so over here we have Tiffany. She had a complete fear of the water, like couldn't even get in the water. So over time, she worked with our coaches, with what we call swim angels in the water, helping her. Those are alumni who came back from years past to help people now learn to swim, be their mentors. And so she actually was featured on the news with her mentor who's on the bottom there, Teresa, because they were like a matched pair. And then the whole time, they went through the process together, and by the end, you can see Tiffany not only coming out of after the quarter mile swim in the water, but also crossing the finish line. Huge successes. And fitness trackers, we have everyone use a fitness tracker. We either provide them or use their own so that they can track their heart rate, their benchmarks, and we make sure every week that people are meeting whatever they need to be able to do to get across the finish line safely and successfully. It's very comprehensive infrastructure of mostly volunteers. We have some paid coaches, but we have our leadership and our alumni who come back as swim angels. They come back as mentors. We have a lot of medical volunteers, and a huge component is family and friends that are helping people do their training at home. So these are some examples of our team, and I mentioned to you how the shirts are all color-coded because it's important to us that everybody remembers this is a team experience. They are a part of a team. We care about them every week. They come and see the same group twice a week for training, and it becomes very, very tight among the cohort, and then our alumni are supporting them, and it's just, I think it's very reassuring to people, but it's also motivating to see their friends every week. This is a really important part of our program also, is that they at home have to practice 3 times a week. So they have their coworkers, their friends, their neighbors, their family members. And the stories we hear about people all walking at lunch together to help somebody with their training, or the moms that'll say, my child said they couldn't really help me during my treatment, but now they want to help. And so they're biking next to me while I'm walking. And it's neat to see how the ripple effect of what's happening with training. We also, it's really important to us that people have new ways of looking at preparing food and eating food. So we have an alumni from 2015 who's actually also a registered dietitian. So she does examples of how to cook and how to prep and what does portion size look like. And we also have articles that we share every week in sort of a semi-little newsletter to people so that they're always feeling that they're gaining a whole new lifestyle. And then we also found out, we know that 70% of our alumni say that they have continued even years later to exercise, and 100% would recommend the program to a friend. But some of them were saying, I need help to stay accountable. So in 2018, we started a year-round training program. We meet once a week, and that just helps people. And in like a sweet thing that happened last week was somebody broke her foot, so she couldn't come to walk. But she was nervous because they thought they saw a mass, and she was worried about it being cancerous. So she came just to stand and be in the presence of the other 30 people, because they all wanted to hug her and wish her well and ask how things were going. And so even though she couldn't exercise, she came just to be a part of it. And I think that that's so powerful. We also have a private Facebook group because we have people who are now become friends and they are putting it out there. And what's so incredible to me about this is that it isn't exclusive. It's who wants to go kayaking this weekend? Who wants to go do this race? And I think that's really important because people now have found a community that understands them. One of our athletes is an identical twin, and she told me I never could talk to her because she's too afraid to talk to me because she is worried about her own diagnosis and sad for me. But she's like, now I have this new group of sisterhood of people I can share and talk with. So it's a testament to change lives. This is Kim, who was telling us she had really not been a very healthy person. So she had gone and met with her financial planner and wasn't really seeing, like, she was kind of planning out how long she thought she needed to budget for. And then she went and met with her primary care physician and realized that a lot of her, after going through Team Phoenix and continuing her exercise, a lot of her test results were way better. So she had to reset up her appointment with her financial planner, which we thought was great. So we're really fortunate to have a wonderful grant from the American Cancer Society in Coles that's helped us now expand to 4 sessions that are going to be on the track and then followed by a nutrition and healthy eating session. But what's great about this is for all female cancer survivors in the area. So even people who don't want to join our triathlon training program, or even people who are thinking about it, can come get a taste of what it's all about. And our alumni are super excited to be inviting their friends and families who are survivors, and our clinicians can encourage patients who maybe aren't ready to do the 14 weeks, but would like to start getting the camaraderie of being with other female cancer survivors. So this is just sort of a summary of the things that are important. I think we're going to be sharing these. I'm happy to talk with more about this, but if somebody wants to start a program, these are the things we have found to be critical. And if you're interested in reading personal stories, these are some of the magazines we've been in, Sports Illustrated, like where they're telling a person's story and how their experience changed their life. And if you have any questions about Team Phoenix, want to get involved, want to refer anybody, or want to possibly look at trying to structure something like this, please reach out. I am Team Phoenix at AAH.org, and I'd love to talk with you. Thanks.
Ilka mentions the American Cancer Society, and it just so happens that our next presenter is Kim Kenner, who is a Senior Director for Cancer Center Partnerships. Guess where? At the American Cancer Society.
Hi, everyone. Thanks for hanging in. I know we're kind of sitting between you and me and the conference here. There we go. Okay. Do we have any football fans in the audience? There we go. Awesome. Okay, we've got a few. I am going to talk about a pilot project that we have right now with the American Cancer Society. For those of you that do watch football in the NFL, many of you have probably heard of Crucial Catch, and hopefully you saw that last month. Crucial Catch is a program that the NFL has had for, over a decade, where they are trying to bring awareness to the importance of cancer screening to everyone. It initially started out really on breast cancer screening, and then expanded out to all cancers and all cancer screening. And one of the cool things about that is the proceeds from Crucial Catch actually come to the American Cancer Society. And for a very long time, like I said, over a decade, we've been utilizing those funds to work with FQHCs and community clinics around improving cancer screening efforts, and that always involved as well a grant to that particular FQHC or community clinic to work on that. The project I'm going to talk to you about today really expands upon that. We were approached last year by the NFL around the need to really address breast cancer screening disparities, and how could we do that in a more you know, community, response, fashion, and create like that medical neighborhood. So I'm gonna talk a little bit about this. It's very new. We just kicked it off this year. So our two partners in this project are NEW Community Clinic, which is an FQHC in Green Bay, and Bellin Health, which is one of the health systems in Green Bay, but Bellin also has the distinction of being the NFL affiliated hospital for the Green Bay Packers. And so each NFL market, each NFL team, I didn't know if you knew this, has an affiliated hospital or health system. And so as a pilot, the NFL offered to fund these projects, 6 of them across the country. And I really advocated for Wisconsin to get that and Green Bay to get that, and Bellin and NEW Community Clinic. So, you know, one of the questions is, you know, why are we doing this? And why is it important to do that? Well, one of the things is that, you know, we know that screening and breast cancer screening is certainly a process, but it's not a singular event. And what many of us are seeing, and I feel like I'm preaching to the choir, is it requires a lot of coordination, communication. If there is an abnormal finding, you know, requires additional follow-up, care, and then if there is a diagnosis, getting them connected to timely quality cancer care. And all along that process, things can break down, things can happen. And really, truly, the whole premise of this program is to build a really strong partnership between Bellin and NEW Community Clinic for NEW patients, that they are getting timely screening if there are abnormal findings or diagnoses, that they're, again, also getting that timely follow-up care and then cancer treatment, and that coordination is relatively seamless between NEW Community Clinic and Bellin Health. This slide also, again, you know, really kind of says it all as well. I mean, what we're trying to do is improve the risk, improve the outcomes for people that are at risk for breast cancer, that are served by community health centers. Again, as I had mentioned before, our success really depends on that strong partnership, and that is a lot of what this grant is focused on and that we're working on. I had mentioned we're part of 6 pilots across the country, so you can see Detroit, Buffalo, Miami, New Orleans, and then Seattle are the other sites as well. Our objectives for this project certainly increase breast cancer screening rates. I mean, that is, you know, one of our main goals, but also to ensure that we have that timely follow-up care. It was really important from the very beginning that we secured leadership, buy-in and support from both Bellin and from NEW Community Clinic, and I'm just thrilled to say that that is absolutely happening from the very beginning. Our goal is to really strengthen that medical neighborhood, and then we are implementing quality improvement tools to really strengthen that process. So at the core of it, it is a quality improvement project. We work really closely with both Bellin and NEW Community Clinic, and we work as a team. I'll talk about this a little bit later, monthly, to focus on, okay, what are the evidence-based interventions that we're going to be focusing on, and where are we along that process? We do, and we talked about this earlier, data, of course, we are using the data all along the way to inform all aspects of the project. And ultimately, we want to be able to execute a sustainable and meaningful process improvements, but also we want this project to be sustainable. It is a 2-year pilot project. I mentioned we're one of 6 sites across the country. Each site, so both Bellin and NEW Community Clinic, received grant funding more to the FQHC to help support their efforts because of their patients that we're helping to improve screening, and then less to the health system as well. This gives you a little idea of the partners that are involved. ACS, we're really acting as that convener, coach. We bring both the teams together. We facilitate dialogue with both of them and do the overall project management and the quality improvement support. The hospital's responsibility is really to improve that screening completion process and the time to follow-up care, communication of the results of the mammogram or any other diagnostic testing, and then ultimately treatment plans to that referring provider from NEW. On NEW Community Clinic side, on the community health center side, their role is to really improve their overall screening rates, their referral processes, and communication with the hospital partner. And you'll see, I mean, communication comes up a lot in terms of this project, because we're bringing essentially 2 entities together who may have worked, and they have worked together in different projects for their patients, but this is completely new for them. And then we're fortunate to have as well intervention colleagues. So we have a whole interventions and implementation team that helps provide technical assistance not only to myself as being sort of the boots on the ground local person, but also provides technical assistance to both NEW Community Clinic and Bellin Health as needed. So why links to care? I again, preaching to the choir, I think everybody knows this, that, you know, early detection of breast cancer through mammography is critical, and that reduces mortality from breast cancer. There are lots of issues around this, around breast cancer screening. There's certainly patterns of late stage disease in certain community groups. There are issues around fear of getting screened, fear that cancer may be detected. There are barriers around transportation, financial barriers. I think this was mentioned earlier, not having paid time off. And as we worked with both teams, Bellin and NEW Community Clinic, these were some of the main barriers that came up. Financial barriers, barriers around transportation, insurance barriers, not having that opportunity to have the time off from work to get needed screening. So again, we're working, this project is really working to improve that partnership and provide that kind of breast cancer screening. A big component of it, I would say, I'm just going to back up a minute, is it was really fascinating to bring the 2 teams together. We kicked off in April with an action planning meeting, and it was very, very interesting. It was the first time those 2 teams came together, and they each talked about the barriers and challenges, you know, that they face as providers in their setting. There are a lot of process barriers within each clinic, but then for the Bellin team to hear from the NEW team the other barriers that their patients are facing and how we address these together. All right, 2 minutes. Okay, all right, thank you. All right, real quick, there's just a couple of slides in here. I'm gonna leave I won't go into depth on these, but this is a great slide that kind of depicts some of the barriers that patients will experience along that way in terms of, getting that breast cancer screening. Initially, there may be barriers around health literacy, again, like I mentioned, fear of cancer and cancer stigma, and limited or no access to a primary care provider. And oftentimes, that's what NEW Community Clinic is facing when their patients come in. They may just be walking in and not have a primary care provider in their establishment for the first time at NEW Community Clinic. Then when you move on to the next stage of actually, having that clinical evaluation, diagnosis, and ultimately if there's staging and then treatment, there are a variety of barriers that patients encounter. This is a great slide. I like to just put it in here because this is what patients face when they're having a mammography. Initially, of course, it's screening and potentially biopsy, but they're interfacing with a radiologist, eventually a pathologist, and a technologist. And then if they do ultimately get that diagnosis, then again, they're interfacing with other providers as well. And if they have to have surgery, they're interfacing with a breast surgeon and a plastic surgeon and a nurse. And so it gets very complex and a bit convoluted. And so if there's any way that we can help them, kind of understand this whole journey along the way, that makes a difference, but it's daunting. So here's just our progress today. As I mentioned, we just kicked off in April. We've had a couple of action planning meetings. We developed our aim statement. Both systems submit baseline data regarding not only their screening rates, but what is their process? What are the processes that they have in place for getting their patients, eligible patients screened? And then we have monthly team meetings. And most recently, we were doing some process mapping. So we really took a step back, for example, with NEW, and process map the whole process. When a patient initially comes into the clinic, how are they determining if they're eligible for breast cancer screening, their standing orders, and then what is that whole step along the way? And each staff person at NEW clinic who has a part of that process talked about what they needed to do, and then also the barriers that they encountered. This just gives you an idea of the core team members. I think it's really important. First and foremost, we have health system leadership buy-in. Each system has a clinical champion, quality improvement lead, information technology, and as you can see here, sometimes it's the same person that is representing that role. Populations health manager is critical, care coordinators and navigators, marketing, community outreach, grants administration as far as administering the grants that they each have, and then and then this is my last slide. This is our aim statement, which looks pretty lengthy, but the reason it's lengthy is we not only wanted to capture, for example, the SMART goal of we want to increase breast cancer screening rate from 44% to 64% and develop that process of ensuring a timely follow-up. But we also wanted to include the why. Why is this important for the team? So the whole team is bought into this, that we understand that breast cancer is the most common cancer diagnosed in Wisconsin. And for our community, it's about preventative care to keep the community well and increase access to care while ensuring those quality outcomes with evidence-based practices.
So that is where we're at. I mean, I told Beth I would share where we're at right now. We're very, very early on in the process. I am hoping that, give us until next year. Love to come back with some of our colleagues from NEW Felon, to really talk about hopefully, you know, the success that we've made of this project and how we're moving it forward. So that's it. Thank you.
This is the final session for the summit. We have just one more speaker. Kelly Hackett is the Mammographic Quality Initiative Project Manager with the Wisconsin Women's Health Foundation. So Kelly, I'm gonna turn it over to you.
Hi, everyone. So before I jump into some of our programs and successful actions in Jesus, I want to start with a brief list of stories that I think some of you have had today. And the foundation, the woman in the center of that photo, Suzanne, she founded the Wisconsin Women's Health Foundation over 26 years ago after her own battle with breast cancer. Her daughter, Tommy, on the far side of that photo in pink, she is now our executive director, and she's also a two-time cancer survivor. So cancer has always been very dear to what we do at the foundation, even if not the explicit, short-term outcome we're working towards. It is at the heart of some of the things that we do. The first program I wanted to share today is one we're probably best known for, and this is the First Breath program. So this program has been around for over 20 years now, and it's specifically aimed at helping pregnant and postpartum community members in commercial tobacco cessation, and in recent years has expanded to other substances and alcohol as well. There are professionals, healthcare providers who are already touching with community members, working with them, who referred on to the First Breath program, and our First Breath educators take it from there. They support everyone who goes through this program without judgment, which I think is a big key in so many of our programs. They provide very kind and genuine care to people as they're trying to work through this and navigate it for their pregnancy. And of course, this reduces a lot of exposures. And so in the last over 20 years, we have reached nearly 24,000 community members. And that, of course, doesn't even include the number of children and additional family members who may be living in that situation as well. So we think that this is a great link for cancer control efforts as well, when we consider that we were reducing risk with tobacco and alcohol. The next program is our Grapevine program. So this is, I would say, our other bread and butter program that's been around for a very long time. So Grapevine is meant to be a community-based chronic disease prevention program. And the focus is on developing really reliable, up-to-date information on all of those health topics listed there. And then there are healthcare providers and professionals from all over the state who are trained in administering health education sessions. So that when community members attend the sessions, they are receiving the information from people who understand the geography that they live in, the specific access barriers they may face, and can really tailor that information to the people who are attending. We obviously up there, you can see breast and gynecologic cancers are listed, so we do specifically do sessions on cancer. But obviously, many of these other topics are risk factors for cancer, or as we've heard a lot today, these can be things that survivors are dealing with after they go through treatment. So even last year, after a lot of pivoting post-COVID, we were still able to reach over 1,100 community members across the state. So we have continued to expand and kind of pivot from not only in-person, but also virtual sessions. So anyone here is ever interested in becoming trained in the program or would like to share it with any of their communities, please reach out. So this third program, I think, is a lot, it's somewhat newer and it's less well known at this point. But this is the low vaccine center. So this started around 2018, and this program So what this program does is does it through two different prongs. So the first one, we have a one-on-one information and referral call center essentially. So you can call from 7 a.m. to 6 p.m. Monday through Friday with very rare exception. We have staff members who are going to answer that line. And if you have an issue, say you are asking about, you found a lump and you don't have insurance. They are the official members for the Disaster Development Program. We've been longtime partners with Heubel, and they are going to refer you to the program. And at the same time, they're also going to find a really gentle way of asking you about all the other things that somebody might need help with. We have seen and heard so many times today that people may be dealing with all kinds of social determinants of health issues. We hear a lot of people who are needing assistance with food, needing assistance with housing, and our specialists will connect people to every possible resource that they can think of. Last year, we did 2,500 community members, and each one of those cases, the average was 6 referrals to warm handoffs, specifically to different coordinators or different programs. So we're really trying to get people connected and supported across all of their needs, especially because everyone deserves to have all of those supports. And the other thing is that we do have an online directory that they have been slowly building over the last 5 years. And this is something that anyone can use. So you can go to this directory, you can search breast care, for example, and any resources that they have put into it, county level resources, city resources, those are all things that are going to pop up. So this is a way that, we can continue to serve community members and build programs for them where they can reach all the information they need and actually have somebody who's there along the process is going to check in with them after they leave if they haven't heard anything. Hey, did you get that program? Did they call you back? Did you figure out the application? So they're going to be people who are with you every step of the way. So the last project I'd like to bring up is we were at the fireside chat last night. We actually heard a good bit about these projects from Dr. Stolle, but the foundation is a partner on two what we call our collaborative cancer projects. And these are part of the Community and Cancer Science Network at College of Wisconsin. So both of these projects that we are funded on, thank you to Advancing Healthcare Wisconsin endowments. It's greatly appreciated. Both of these projects and all of the other projects in PCSN are specifically focusing on an approach where we want to ensure that everyone who has a stake in that specific cancer issue is actually part of the leadership for these programs. You're not just at the table, you are telling us where to go. And so I think these two projects are kind of really, really fun for us. Felicia and Claire here and Keely and Dale, I'll call you all out, staff at Foundation, also Southeast Florida, WCA. It has been fantastic to meet so many people who have both personal and professional stakes in cancer disparities, and to truly get to know and build relationships with them over these last 2 years. So the first project that we're partnering on specifically is the Mammographic Quality Initiative. Kim, you need to connect. So this project is building a statewide system that is going to monitor and enhance mammogram quality in the state. We are trying to define what mammogram quality means not only to providers, but also to every one of us who goes through that mammogram process. What does that look like? And so what should we be measuring and what should be improved? Our project has started in southeastern Wisconsin so far because we have over a third of our mammogram facilities in southeastern Wisconsin, and of course because those disparities that we see between African American and white women that is largely based in that metro Milwaukee area. We have developed partnerships with 68 and 72 facilities based in southeastern Wisconsin. So this has been a really great one for us so far. The collaborative workers, I'll just say they are currently going through the process of applying for the second phase of funding, and these workers have been meeting very frequently over the last year. The foundation specifically works on two groups in Walworth County on breast cancer disparities, and also Milwaukee County on lung cancer disparities. There are additional projects with our other community partners. The scene in Milwaukee County and also Woodley is working on a project as well with us. And they are currently working on developing their own proposals that they have been building based on what is specifically being seen in these communities and specifically what we need for communities and not just the rest to communities. So hopefully in a couple of years, we will be able to come back and report some really great successes on these programs as well. And then I just want to say thank you to so many of our partners in this room. Dale is sitting right there. Look at me. And I think that one thing across all of these programs that have been successful and that allows us to keep connection are the people that we work with. We do everything that we do for our partners, for the people that we serve, not figure out the programs to them or figure for them. So I just want to thank everyone who is involved in every little way with all these programs at the foundation. And if you need any information, we can have a little table back here. So feel free to stop by. Thank you.
Judy, Ilka, Kelly, and Kim. Thank you so much for sharing with us your overview of cancer control work in human health. I often tell folks that with respect to the Wisconsin Well Woman Program, we're able to do what we do because we've got great partners. And we work all over the state, in the 72 counties, of course, that we work with the tribal nations. And you learn a lot. Some folks bring a little bit to the table, others bring a lot to the table, but it's all very important. Do we have any questions?
I do. For Kim, I'm kind of just curious of why you would start your pilot project in Green Bay when the greatest need is elsewhere.
Yeah, well, again, this was a specific project where the NFL,
Sorry, maybe you can hear me better. The project was based on working with NFL affiliated hospitals. So the only NFL affiliated hospital in Wisconsin is Ballin Health in Green Bay.
Okay.
And there is a need there. There is. I will say that, for example, with NEW Community Clinic, a large percentage of their patient population are immigrants and Spanish as their first language. And oftentimes, as they had shared with us, many of their patients are uninsured. And so we're really kind of working with Ballin to help those screening rates. And you saw earlier, their screening rates are very low.
Do we have other questions? I have one general question, or do we have another question? Oh, okay.
My question for Judy, can you talk a little bit about the effort and perhaps the barriers to getting rental properties tested?
Yes, we have had, we tried to test tribal members' homes. And there were a few barriers with the rentals being the people that actually own the property being unaware. We were able to help some people that lived in rental homes actually do the mitigation, and that seemed to satisfy the actual owners. Knowing that they wouldn't have to fork out the money to actually do the mitigation. But most of the homes we did were within, they were owned privately on tribal lands. People can own their homes, but they don't actually own the property. So it's a little bit different, but most of them were pretty open to it.
Another question
We have another question.
for Judy. I assume you take donations, and if so, how would one do that? Or where's it go to?
We do. It is all processed through our tribal financial, office, so, you know, they take it and then they put it into an account for, you know, if it's for a specific person, then, or a project, they put it into that account, so. That's,
And how would one look that up?
well, you could, contact, any of the, you know, tribal officers or tribal council or.
Okay.
Anyone.
Thank you.
Let me know and I'll get her the money.
I'm not giving it to you.
No, I'll get you connected. And Judy, how's that?
Do we have any other questions? If we don't have any other questions, again, I'd like to thank our panelists and thank you so much, all of you, for all of the good work that you do. You are making a difference in the. Okay, Paula, if